the large, the high, probably the hardest thing involved with it is it's changing a behavior that, has been, really ingrained, especially in folks that have been going to the doctor for a long time. They were conditioned to, paying, $10 or $20 for many, many years. And then we had to shift to this, this idea of more and more money being asked for from the patient. And, many of them haven't, still have not, adapted to it. I can tell you, for many, many years, long before high deductible plans, one of the things that we would do in our practices is we would look at the idea of remember the Medicare deductible. So we have the Medicare deductible every year for folks that are straight fee for service Medicare. And the numbers used to be, well, the first $100, hits the deductible. So what we would do is certain practices that were not real cash flow dependent or weren't too concerned and had enough cushion in their practice. What they would do is we would just hold these claims. So, the first month of service, the first month of the year, all the Medicare claims for January, we would just hold. Normally it's, we are not going to be the only provider, the only medical service they're going to seek in January. So we might hold all the claims till the end of January, middle of February, and then release all the Medicare claims. So, okay, what does that accomplish? Well, somebody else got stuck with, chasing the patient down for the deductible. So, I mean, in today's day and age, it doesn't sound like a whole lot. Back then it was a relatively big deal. It's the same sort of idea here. We'll see, today we see many cases where, a patient at the very beginning of their deductible, they're going to go into a healthcare facility for a surgery, and, the surgeon will wait until, the facility has sent their claim in. So the facility sends their claim in. Maybe it's a $3,000 deductible, their bill is $10,000, whatever it is. The facility gets stuck chasing that patient down for the financial piece that relates to the patient. The surgeon sends their claim in, end of January, middle of February, whatever. The nice thing is they can, depending on how much work you want to do on this. And some people are very serious about it and will not submit the claim until that deductible has been met. They'll hold the claim for, 25 or 30 days, go check the site. Yep, patient's met the deductible. At that point, they'll file the claim. So not everyone is in that financial position to be able to do that, but that would be a strategy that, you could employ to, to try to combat chasing large dollars from patients that might not have that money available.